With Maine Parent Federation, we are a nonprofit, grant-funded organization that serves families who have children with special healthcare needs and disabilities. And all of our services and programs are free to families in the state of Maine. They include the workshops like you're attending today, as well as parent information specialists who are on staff to answer individual questions, both via email and phone call, and then our parent-to-parent peer program, which is called our Family Support Navigator program, where we match experienced parents of children who have special needs, and we train them and match them up with parents who are looking for assistance in navigating any of the systems of care. So that's us in a nutshell. I'm joined today by my colleague, Dylan Campbell, and I'll turn it over to Dylan for his introduction.
Yeah, thanks, Jody. Hi, everyone. I'm Dylan Campbell. I'm a parent trainer here at Maine Parent Federation, but I'm also a youth coordinator. So what that means is I do a lot of work with youth around self-advocacy and youth leadership. I am not a parent of a child with a disability, but I do have some background experience navigating the system with my multiple siblings. I just wanted to thank you all for being here today, and I'm excited to talk about the Katie Beckett Waiver Program. So back to you, Jody.
Great. So this workshop is one of our more recent ones that we have rolled out to the public. I believe we started just in January of 2021. And it was really due to the feedback that we were getting from families in our community, where they found the Katie Beckett waiver application process really complex and challenging. And a lot of the work that our organization was doing was to support those parents in their application process. And so this workshop was born out of just feedback from you all and the need to have the process explained a little bit better. So that's that. Dylan, you can get started on the first slides if you want.
So this slide right here is just stating that we are not a legal services agency and we cannot provide legal advice or legal representation. So you should think of all the information that we're providing today as a public service announcement. So first off, we're going to start by reviewing some important terms, some terms that you'll hear as you move forward with the Katie Beckett waiver process. And then we'll explore the process. We'll explore the Katie Beckett Waiver Program and Maine Care, and we'll talk about some of the similarities and a couple of the differences there. And then we'll also explain the application process. The Katie Beckett Waiver application process can be quite lengthy and complex. So we're going to break it down into a few easy to follow steps. And then at the end, we're also going to answer questions. We are live on Facebook as well, so I posted a message saying if you have any questions, please post them, and we'll answer them live during a webinar. If you're on Zoom, just please post in the chat box and we'll try to answer them as we go. So the first term that we're going to discuss is the Department of Health and Human Services, DHHS. The Department of Health and Human Services is comprised of various offices and divisions that oversee and administer critical programs for the state of Maine. So the Department of Health and Human Services is a large umbrella that oversees many other programs. Some of those programs are the Office of Child and Family Services, OCFS, Licensing and Certification, the Office of Aging and Disability Service, or ODS, the Office for Family Independence, OFI, the Office of Maine Care Services, OMS, Office of Behavioral Health, OBH, the Riverview Psychiatric Center, which is located in the Augusta area, the Dorothea Dix Psychiatric Center, which is located in the Bangor area, and the Maine Center for Disease Control and Prevention, CDC. Today, we're going to focus on talking about the Office for Family Independence, OFI, and the Office of Maine Care Services. So OFI is the Office for Family Independence. So this is the DHHS agency that determines if someone is eligible for Maine Care, including Katie Beckett. On the other hand is the Office of Maine Care Services, OMS. This is the DHHS agency that pays providers for the services they provide to Maine Care members. The Office of Maine Care Services facilitates the medical assessment process with KeyPro and collaborates with the Office for Family Independence regarding medical eligibility. The Office of Maine Care Services also tracks the financial charges to ensure the member does not exceed the annual maximum amount that Maine Care will pay each year based on the level of care needed. So essentially, the Office of Maine Care Services tracks the finances between the different Maine Care providers. KeyPro, which I just mentioned a moment ago, this is a third-party agency that contracts with DHHS. So this agency has a contract with DHHS to complete the medical assessment to determine whether a child meets the standards for institutional level of care. Another term that we're going to talk about is the medical review team. And the medical review team is a joint collaboration between Maine's Department of Health and Human Services and the University of Massachusetts. So the medical review team is responsible for reviewing the individual's medical documents to determine if they meet Social Security Administration's disability standards. Again, DHHS has a contract with the University of Massachusetts to conduct this review. And so what is the Katie Beckett Waiver Program? Well, to put it short, it's a way for children to access Maine Care benefits and qualify based on disability or special health care needs. So Katie Beckett Waiver is a Medicaid waiver, and it's for children with serious health conditions who are not otherwise eligible for Maine Care. And if a child meets the eligibility requirements for Katie Beckett, they are guaranteed full Maine Care benefits. And these Maine Care benefits include insurance coverage for doctor's visits, hospitalizations and medications, access to all therapies, whether that's physical therapy, occupational therapy, or speech therapy. And it's also fulfilling the prerequisite for accessing support programs, such as Section 28 rehabilitative and community support services.
And just to clarify, Maine Care is Maine's low-cost or free healthcare option. It's our state's Medicaid program. So let's look at who's eligible to receive benefits through the Katie Beckett Waiver Program. This applies to children who are under the age of 19 because it is a youth service program. It is not an adult service program. A child must have a physical or mental disability that will last at least 12 months. And the child cannot do what other children of a similar age can do. The child must meet the criteria to be considered disabled by the Social Security Administration. This is an important point, and we'll hit back on this again later in our slides, but it's important to note that the criteria used to determine eligibility is the same criteria used by the Social Security Administration. But even though it's the same criteria, you're not actually applying for Social Security benefits. The child does not have resources greater than $2,000 and has a monthly income less than 300% of the supplemental security income, or SSI. And the child does not qualify for Maine Care under any other category, for example, income. And that's what Dylan was saying in the previous slide as well. The child must live at home, but requires a level of care provided by a hospital, nursing home, group home, or psychiatric hospital, or the child lives in one of these facilities, but is being discharged and continues to require the same level of care. And the last thing is that costs at home must not exceed the costs Maine Care would pay if the child were in an institution. Now we're going to look at what it takes to fill out the Maine Care application. The first step is to apply for Maine Care to see if your child qualifies based on the family's income rather than the child's disability. So again, Katie Beckett is based on the child's disability, but the first step is to actually apply as a family to see if the income qualifies. So this is referred to as modified adjusted gross income, or MAGI-related coverage. And if your child qualifies based on the family's income, then full Maine Care benefits are awarded. If that's true, then the rest of the Katie Beckett application process doesn't apply here because your child would have already received those benefits. So you fill out the Maine Care application, and you can do this right online through My Maine Connection, and we list the link there for you. We also took a screenshot of what that Maine page looks like, so you're familiar with it. And you can just see kind of all the bits of information, the contact information, and the links available there as well. Filling out the application is extensive and requires many official documents. These may include paycheck stubs, loan statements, medical insurance card, employer statement verifying gross wages, bank statements, passport, unearned income, for example, child support, certificates of deposit, retirement account information, driver's license, life insurance policies, and self-employment business records. So there's really a lot of advanced work that you need to do in order to collect the documents to fill out this application. This application is also used for the following government programs: state supplement, prescription help, family planning services, and Medicare savings program. So it's really important when you're filling out the application to ensure that it'll be processed correctly. This is where our family support navigators can come in. At the beginning of the webinar, I mentioned that we have our peer-to-peer parent support program, and they can come alongside you and help you to make sure that you're really moving in the right direction with the application, that you're not overlooking something, and that you're providing all of the correct information so that your application is processed in the correct manner. It's also important on the application to state that your child has a disability. This should signal the eligibility specialist to screen for the Katie Beckett waiver. So again, you're applying for Maine Care based on the family's income, or what's referred to as MAGI-related coverage, but you're going to want to signal on that application, you're going to want to state that your child has a disability. And so therefore, the person who is screening for eligibility should note that and then start the process towards Katie Beckett waiver. I'm going to pause for a second because I can see we have a question. Will this PowerPoint be available after the program for reference?
Yes, it will be. I can add a slide. If you stick when we're finished, I can add a link to the chat box where you can download the slides.
Perfect. Okay, so they will be downloadable. All right. We can go on to the next slide. Perfect. You will receive a Maine Care denial letter if your child does not qualify based on the MAGI-related coverage. So this is true for every person who is applying for the Katie Beckett program, is that first, because you're applying for Maine Care based on the family's income, if you do not meet that threshold, if you exceed that threshold, you will receive a denial letter. But this does not automatically mean that your child is ineligible for Katie Beckett. And it can be a source of confusion for families. And sometimes they stop pursuing the process, the application process, because they think that it means that it's been shut down and that their child does not qualify for Katie Beckett. In order to be found eligible for benefits, OFI, or Office for Family Independence, will determine if your child meets the financial rule as well as the medical rule. The financial rule is that the child does not have resources greater than $2,000 and has a monthly income less than 300% of the supplemental security income. And we referenced that in the beginning of the slides as well. So the financial rule is considered in combination with the medical rule. And the medical rule being that the child meets the criteria to be considered disabled by the Social Security Administration. And once again, you're not applying for SSA benefits, but it is the same criteria used. Every year, a financial review is required to make certain your child does not qualify for Maine Care based on that fee-free MAGI-related coverage or SSI-related coverage. Following up with Office for Family Independence is extremely important. And if you have questions about the status of your child's application or about a denial you have received, you should reach out to OFI directly. And we've listed their telephone numbers as well as their website on the bottom of this slide. So I see a question in the chat box. Does resources mean what the parent makes? And I assume you're asking about the financial rule for the child in the Katie Beckett process. That does not consider, yes, it says, okay, so that does not consider the parent's income. That is looking strictly at the child. And so some children may be receiving a different benefit already, or they may have assets in their names. And so There's that financial rule slide. Perfect. Thank you, Dylan. So the child does not have, more than $2,000 in a bank account on their name, and they're not receiving a benefit that's 3 times the amount that supplemental security income would be. And it's just looking at that individual child who has the special health care need. Step 2 is to fill out a Maine Care Disability Determination packet. Even though it's listed as step 2, you can actually do this at the same time that you're filling out the Maine Care application. We encourage you not to wait to receive a determination about the eligibility of Maine Care based on the family's income before completing the disability determination packet, because you can move the process along in a quicker fashion if you do these at the same time. The disability determination packet requires the following forms, and it's information about the nature of the disability, extensive health history, education and work history, evaluation of activities of daily livings, which are ADL, and those evaluation forms are not intended to be filled out by a professional. They are included in the packet, and a parent or guardian can do that at home. Parents should attach a letter or make note on the packet under the section additional information to indicate that they are applying for the Katie Beckett Waiver Program. There is no option on the form to indicate you are applying for Katie Beckett, so you must include your own statement. So this is one of the most key takeaways from today's presentation, is both in the Maine Care application as well as the disability determination packet. There are not sections already in place to indicate that you are applying for Katie Beckett for your child. And so it's really important that you include that information. Whether you include that in a section that says additional information, or you attach a letter stating what it is you're looking for, we really encourage that you note that somewhere. Actually, I have a note here. If a family did not qualify for Maine Care under the financial qualifications, Office for Family Independence should automatically screen your child's application for Katie Beckett eligibility. However, it's recommended to flag your application to ensure that it moves through the proper process. So this is just one extra step that you can do to help that application get into the right hands. Then once it's complete, the disability determination packet will be reviewed by a third-party medical review team. And Dylan talked about that in the beginning, that Maine has a contract with UMass, and so that's where the MRT is out of at this point. The purpose of the release of medical records in the Maine Care Disability Determination packet is to provide OFI with the information needed to make their disability determination. So we've taken a screenshot of that as well. This is really important that you make sure that you fill out these release of medical records thoroughly, and that you include any provider at all that the child is working with to help substantiate your case for the disability determination application. At this point, you would contact OFI with any questions, and they could provide an update on the status of the medical review. Something I failed to mention earlier is the disability determination packet is accessible online, but it's accessible in paper format to download and fill out. So there is no online platform to fill this out. There is an online platform, as we discussed, for the Maine Care application. And so typically you end up submitting that first because it's instant online, and then the disability determination packet can take a little bit more time often to print and fill out and then mail back. After you've completed steps 1 and 2 of the application process, the medical review team will assess the information and determine if your child meets the disability criteria. The MRT will work with your child's providers to compile necessary medical documents. It's important to fill out all of the medical release forms when completing the disability determination packet, as the MRT will rely on those releases when accessing your child's records. So this is what I was saying a minute ago, is it's really important to make sure that you give the medical review team access to your child's providers so that they can get an accurate look of the diagnoses. Additionally, you should give your child's providers advance notice that you're applying for Katie Beckett, because they will only have 30 days to submit their documents during the medical review. So, there can be a lot of documents requested, there can be a lot of moving pieces, but again, another tip that you can do as a parent is to give those providers advance notice so they can start collecting the documents that they need and be prepared to submit in a timely fashion. KEPRO. So we're going to talk about the KEPRO assessment and that phase of the application process. This is step 3. So step 1 was applying for Maine Care and the MAGI related coverage. Step 2 is the disability determination packet. And step 3 is the KEPRO assessment. The eligibility specialist at Office for Family Independence will make a referral to KEPRO if they determine your child may qualify for the Katie Beckett program. And that's because they've looked at your Maine Care application and they've seen that you don't qualify for the family's income related coverage. And they see that your child has a diagnosis. And so it's been flagged by the eligibility specialist and they make that referral to KEPRO. A registered nurse who works for KEPRO will perform an in-person appointment to assess your child's level of medical care. This assessment is usually done at the local Department of Health and Human Services, DHHS office, and your child must attend with you. And so that level of medical care is separate from the medical review team that has already been done in step 2 with the disability determination packet. The medical review team will share the medical information that they had previously collected with KEPRO, but KEPRO may still ask for additional information from your child's providers or more from you as a parent. And at this point in the application process, if you have questions, you would contact KEPRO directly because they are the ones housing your application and it's moving through their channels. And we've provided KEPRO's phone number there as well. The KEPRO assessment is very comprehensive and requires the following documents for all children, regardless of diagnoses: a list of their current medications, list of current diagnoses from a physician, most recent medical evaluation by a physician. Then if your child receives specialized services and has an individualized education program, individual treatment plan, individual family service plan, individual service plan, or any other type of treatment plan, you must submit the most recent plans, including progress notes and/or 90-day reviews. So it's a lot of documents to start getting together and organizing to submit. In addition to the documentation that I just listed, which was for all children, KEPRO then will require specific documentation on an individualized basis, depending on what diagnosis a child might have. Those additional documents may include most recent psychiatric evaluation, most recent social evaluation, progress reports from therapists, for example, speech, occupational therapy, physical therapy, and then a nursing plan if the child is requiring nursing services.
And step 4 is notice of decision. So this is a statement declaring whether you have been granted or denied coverage. So once all the reviews have been completed, the Office for Family Independence will mail a notice of decision to you, stating whether your child has been granted Maine Care coverage or if they have been denied coverage. If Maine Care coverage is approved, you will receive additional mailings with information about premiums, as well as an official Maine Care identification card. If your child has been denied coverage and you believe this decision was made in error, you may contact the Office for Family Independence to appeal this decision. And again, the denial letter will state the reasons for which your child has been denied coverage. Step 5, Katie Beckett premiums. Under typical Maine Care, a family does not necessarily pay premiums. However, under Katie Beckett, premiums begin at the onset of coverage and are organized into 3-month blocks. You have a couple of options to pay. You can pay your premium monthly or 3 months at a time. If you pay monthly, payments are due the first of each month. However, if you pay 3 months worth of premiums at one time, payments are due by the 15th of the third month. It's important to note that premiums are determined based on the family's income and size.
Now we're going to take a look at step 6, which is the annual review. There are up to 3 parts in an annual review. The first part is that every year a financial review is required to make certain that your child does not qualify for Maine Care based on that MAGI-related coverage. And again, that MAGI-related is looking at the family's income rather than the child's individual diagnosis and financial assets. This is really important that the financial review is done annually because it might affect the monthly premiums that you're paying for Katie Beckett, or it may even end up shifting the kind of Maine Care coverage. And I shouldn't have said coverage there because the coverage remains the same, but how you're accessing it. So you may, if your income has fluctuated, if it has gone down, then you may suddenly be eligible for the fee-free MAGI-related coverage and no longer have those monthly premiums. Or if your income has gone up, then it's possible that your Katie Beckett monthly premiums could be increased as well. Step 2, KeyPro performs their level of care assessment again, including requiring recent documentation from medical providers. And then the third step is again, it's a sometimes step. A medical review from the MRT, the medical review team, is required every few years. So the frequency of their review is actually determined on an individual basis, and it might be different depending on a child's diagnosis. So it's not typically yearly, but it's typically every few years, and the frequency does fluctuate depending on kid to kid. In the annual review, KeyPro requires the same documents that they did for the initial assessment for the Katie Beckett application, and it feels very much the same. KeyPro will mail a notice with a list of required documents to families approximately 2 months in advance of the annual review, and this is to allow families enough time to collect the documents. So my tip here is, if you know that your annual review takes place in October every year, then set a reminder on your calendar so that a couple months before you get a heads up and you start thinking, okay, I've got to start looking towards collecting the documents, getting my ducks in a row. It can be a real time saver because all of those documents that we listed earlier, with all of the treatment plans, all of the progress notes, all of the updated diagnoses, all of the evals, it's a lot to track down and it's a lot to have to present in a hurry. So if you know that your annual review is coming up, then just start getting a jump on it and start reaching out to those providers if you don't have the most recent copies and making sure that you get those. KeyPro will also call 1 month before the reassessment is due to schedule the parent interview. Every third year, the interview must be done in person. Otherwise, it can take place over the phone. The little caveat I would say to that is, during COVID, I know that all of those parent interviews have been actually over the phone because DHHS has not been performing, has not been allowing in-person assessments, and that has extended to KeyPro as well. I did speak with a parent today who had just gone through their initial application process, and they were actually able to do their initial level of care assessment over the phone as well, just because of the COVID circumstances. But typically every third year it's done in person. And when it's in person, the child is required to attend that appointment. If it's on the phone, just a parent or guardian needs to participate. And the questions are really simple. They're a lot about activities of daily living, how much support the child might need, how many activities. It's pretty specific. You know, you go through lists of questions. Can the child button their pants independently? Can they wash their hands independently? And it looks at kind of all the areas of life. And so it's not unlike other assessments that as parents you've probably had to engage in before for your children, but it's important that this is done annually because sometimes children's needs change, and sometimes the level of care will actually increase or decrease based on the developmental growth of that child.
And to make this entire process a little bit smoother, our staff has compiled a few helpful tips to help you. The first one is to check the status of your application. As we keep mentioning, the application process for Maine Care and Katie Beckett are complex and involve several steps. So it's very important to check on your application status to best ensure it is moving through the proper channels. That's why we provided the different contact information throughout the slides, so you can go back and contact, see which steps you should contact which provider. Another helpful tip is to talk with your child's medical provider about the importance of using the correct terminology and medical language in documents. And this is kind of backwards to a lot of the work that we do in trying to get medical providers being more parent and family friendly. But it's really important at this step, if the medical providers do not provide the necessary documents and use the necessary terminology, your child may be denied benefits. One of the most important tips we can give you today is to keep your documents organized. As Jodie had mentioned, there are many steps, many documents that are needed, and it can be confusing to keep all these organized. So a few tips here are to keep a binder or file folder with up-to-date documents from your child's providers so you are prepared for the annual reevaluation. As well as keep a copy of every document that you submit, and consider keeping electronic copies on your computer as well. You could also keep a log of any conversations that you've had, as well as all documents that you've mailed, emailed, and faxed to the Office of Family Independence or KeyPro. And then again, it's important to remember, do not get discouraged if you receive a denial letter. In fact, it's a part of the process. So first, determine if the denial letter is income related or disability related. If disability related, proceed with an appeal. And you can do this by contacting the Office for Family Independence. You should also pay your premiums on time. And this is important because if you are late with your payments, your Maine Care coverage may be promptly canceled. While you can appeal this cancellation, you may be required to reapply, and your child may have a lapse in coverage. And again, our Family Support Navigators, this is our peer-to-peer family support program that Jodie mentioned at the very beginning. And our Family Support Navigators are trained parents who have personal experience navigating the systems of care in Maine, and they can provide support at no cost to you. So please reach out to Maine Parent Federation to be matched with a Family Support Navigator, and they can help you through the Katie Beckett process. So this is just a quick guide to the Katie Beckett waiver application. It's kind of like a bird's eye view of the different steps and moving parts as you move along. The first step would be to submit a Maine Care application to the Office for Family Independence. And the second step, which can happen in concurrence with the first step, is to submit the Maine Care Disability Determination Packet. The third step is the Office for Family Independence will make a referral to KeyPro. And then at this point, the Office for Family Independence will mail a notice of decision indicating if Maine Care coverage is being provided or denied. The fifth step is monthly premiums, which are billed and payments are due on the first of the month, unless you are paying 3 months at a time. The sixth step would be annual reviews, which are held to redetermine financial eligibility. And again, please reach out to us. We're active on all the social media platforms, Facebook, Instagram, Twitter, and YouTube. And check out our website as well.
We actually have something in the chat that's worth mentioning. This person said there's no Maine care premiums during the public health emergency, and that's correct. During the emergency, the premiums have been waived, and a lot of parents were not aware of this. I am a parent who was not aware of that, in fact, and continued paying the monthly premium out of my automatic bill pay, and then received a letter back with a bunch of canceled checks from the state of Maine saying, please don't pay us anymore until we contact you again. So just as part of a COVID support, you're right that there are no premiums for Katie Beckett at this point. So thanks for bringing that up. That's a good point. We would love to take your questions, hear your comments in the chat box at this point. I realize this is a really complicated topic and we kind of breezed right through it, but there are a lot of ins and outs. And so we would love to help clarify anything that you've heard here today or address any specific concerns or questions in the chat box. As that's happening, I'm actually just going to launch a poll. It's 8 questions, multiple choice. If you wouldn't mind just filling that out for us. We're grant funded and we need to collect data on the work that we do. So this helps us to be able to keep doing the work that we're doing. So we'll hang out a while and take your questions. I'm going to stop the Facebook feed. And we'll keep going on Zoom. Maine Parent Federation adheres to both the HIPAA privacy laws as well as the FERPA, which are the educational privacy laws. So whenever you interact with anybody from our agency, it's a completely confidential process and interaction, and we don't share your information with anybody. I see the chat box. All right, we're getting some questions now. So if we already applied for Maine Care and got a denial, but didn't say we are applying to Katie Beckett, do we call OFI to make sure they have everything they need and it goes through the proper channels? Yes, that's a great question. I would say call OFI directly and see where the holdup is. You know, if you haven't heard anything in a while, if you were denied 4 months ago and you're assuming it's moving through the next channels, but you haven't heard anything, I would definitely reach out to OFI. And, you know, it's completely fine if you were looking for weekly updates from OFI. That's completely acceptable. You're trying to ensure that the documents and the applications are being processed. And so you can call them as much as you want. I can see another question. Do I use my Maine portal for info on the status? I did not know about putting that. Was Katie Beckett on on the disability determination pack, it looks like. So I don't know how accurate the status on the My Maine portal is. I don't have personal experience using it. I have heard from others that sometimes it's not quite up to date. And so as much of a pain as it can be to kind of call a big organization and try to reach the person that you want, I would recommend making the actual phone call for an update. And additionally, if you're concerned that you didn't include all of the necessary information in your applications, I would call and talk that through with somebody and just see what next steps they recommend. There's another question. We had Katie Beckett and didn't use services and stopped our coverage. To get it again, do I reapply, or is there a different process if you've had Katie Beckett prior? Unfortunately, you do need to start the application process from the beginning again. It's not it's not really a user-friendly process. And that's part of why we actually created this workshop is, there is a lot of work that goes into it. And if you ever do have a lapse in coverage, unfortunately, you do have to go back to step 1 in the application process. What other questions can we answer for you? You're welcome. You guys are doing great on the poll. We love your participation. Thank you so much. I can see it's anonymous, but I can see how many people are engaging. So that's fantastic. We've got another question. Does an autism diagnosis generally qualify? My son has a diagnosis headed his way and gets speech and OT, but is very high functioning. And I'm wondering if it's worth starting this process. He has a diagnosis headed his way. So, we are not eligibility specialists. So we really can't comment on who can qualify and who cannot. What I can tell you from an objective perspective is the more documentation you have when you're applying initially, the better. And so if you're right around the corner from receiving a new diagnosis and obtaining further documentation that could help support the need for access to Katie Beckett, then that could be helpful to you. So for what it's worth, I would just say the more documentation you have, the better, and the clearer diagnoses you have, certainly the better. So yeah, that's probably all I can really contribute on that. What other questions can we answer? Okay, if my child is receiving services through my personal insurance at a facility that does not take Maine Care, will that hurt my Katie Beckett application? Will I still be able to change to a facility that takes Maine Care when I get it? So if your child is currently receiving services through a facility that does not take Maine Care, I don't see how that would impact your application to Katie Beckett. I think those are just kind of separate incidences, and one shouldn't have anything to do with the other. And will I still be able to change to a facility that takes Maine Care when I get it? So you always have the right to choose who your providers are, and you can work with, if you're looking to keep covered providers by either your private or your primary insurance or Maine Care, if that's the secondary for Katie Beckett, then you would just want to investigate which insurances they take, but you always have a right to choose who your providers are. Somebody else asked, are the premiums less if you have private insurance? So everybody who has the Katie Beckett waiver benefit also has a private insurance as their primary. And so this is intended to be, the Katie Beckett waiver is intended to get you access to Maine Care benefits as a secondary or supplemental insurance benefit. And so the question of are the premiums less if you have private insurance doesn't really apply because it's expected that you have a primary insurance. The premiums are determined based on the family's income, actually. And so that's why they do, once you already receive Katie Beckett, then that's why they continue to do, part of the reason why they continue to do the financial reviews annually. All right, what else do we have? And Dylan has posted the link to the slides on the Google Drive. That's awesome. Thank you. What other questions do we have? And we're happy to keep hanging out and taking questions. And I apologize, we can't actually see the names of the individuals we're talking to today. There was kind of a funny registration glitch, and so we don't know who we're talking to. So if you do want to follow up with us at all, we can put our email addresses in the chat boxes. We normally do that, and I forgot to do that at the beginning. We are happy to hear from you at any point with further questions or a need for resources. Happy to do that as well. All right, we'll give it another minute, and if there's no more questions, then we'll boot off and you guys can reach out to us at any point. Cool, thank you guys.
You guys hear me? I hear you guys emailing me now, so I'll send those slides right out.
All right, thanks so much for joining us today. And don't be afraid to reach out if you guys have any questions.
All right, thanks everyone.
Bye-bye.